I can't pretend to be an expert in dementia, even though I should be, because my own mother had dementia. She had both Alzheimer's and a dementia-type disease. And yet, after, I guess, 10 years of her condition before she died, I don't know that I really understood any more about it. All I do know is that living with it was terribly, terribly testing. For her, I think much more than for me and for my siblings, but it's a devastating condition. And currently about 700,000 people in the United Kingdom have dementia. According to the Department of Health's National Dementia Strategy, that figure is going to double to 1.4 million over the next 30 years. At the moment, only about a third of those with dementia ever get a proper medical diagnosis. And there are several reasons for this. A recent survey of GPs by the National Audit Commission showed that, well, doctors themselves feel they don't know enough about dementia to recognise it at an early stage. Though they want to provide more care and support for patients, many doctors believe that little can be done to help people with dementia. Sometimes patients and carers have to wait for weeks, even months, to get a formal diagnosis before any intervention or treatment can begin. This film uses selected video and audio clips from the Patient Experiences website, HealthTalk Online, to illustrate what it feels like to live with dementia firsthand, and also at one removed as a partner, family member, or carer. It's designed to trigger discussion about different aspects of dementia, from behavioural changes to examples of misdiagnosis, the idea being to encourage you to talk to each other about what you can do to spot dementia sooner. If people with dementia had early access to genuinely proactive dementia services, they and their carers would be far better prepared for the challenges of this complex and very demanding disease.
In the early 90s, I became aware that my husband was getting a little bit less quick on making decisions or remembering things. He was older than I, so he was then in his 70s, well, early 70s. And I just thought, oh, he's getting on a bit, you know. But it was clearly more than that after a little while, I realised. And he was also becoming increasingly concerned about his eyesight, having lost the sight of one eye during the war, and the other not very good. Looking back, I now realise this was because he was beginning not to recognise letters, and it was the beginning of him not being able to read signs or the newspaper quickly and things like that. At the time, I just thought he was possibly having more problems with his eyes, but this turned out to be the case, but wasn't related to what I now feel was really wrong with him. His speech also became very less clear. He'd always been a very clear and decisive speaker, using the right words and syntax and everything. So there was, he used to stumble for a word, a perfectly normal word, nothing peculiar, and not be able to grasp what had been said to him very quickly. And after about a year, I thought maybe he'd had a slight stroke. Sent him to, I think it's called a geriatrician, who gave him all sorts of tests and came to the fact there was nothing wrong other than the possibility of the beginnings of dementia. And suggested he just take an aspirin every day to stop any deterioration or help with any deterioration, which he did. And this went on for some years with him getting steadily worse.
Before the diagnosis, I found it difficult to understand what was happening with my wife. She was never ever a selfish lady. She began to get a little bit selfish, that when we had the food she would want hers first, even before the grandchildren, which was totally not her. I've already said that her diet changed tremendously. conversation with neighbours, with friends and relatives changed, because now I realise that she was losing her vocabulary, losing the understanding of words, and therefore finding it difficult to have a conversation. After the diagnosis, then that became easier to understand and accept, and at least I could then explain to the people what was happening with my wife and the behavioural changes that were taking place. Early things that I noticed before the diagnosis were things like when I'd cut the grass, it was never short enough, or it wasn't the fact that she was pleased to see something done. It was always what I hadn't done, which was not her at all. There were lots of behavioural changes that took place initially.
Probably, looking back, it would have been a good 10 years ago with what happened was my last year working as a registered nurse in a big emergency room in Toronto, Canada. I started to have angry outbursts at one doctor in particular. I had never displayed these angry outbursts before in all my career. I mean, I had of course been angry but never showed it to anybody. And luckily it was just between him and I, sort of in a back room sort of thing, and we were in a room, and we didn't, but it kept happening. And I decided that I was probably just burnt out. But what happened was I made a huge career and lifestyle change, and reading the literature now, and I do read the literature because I have had a medical background and I'm interested in it, that can be a sign of right frontal lobe damage problems. And so maybe that was the start of my disease. First, the uncontrollable, uncharacteristic outbursts of anger. But then when I started with Medtronic, I had a regular job and a lot of responsibility, quotas to fill. I'd never been in sales and marketing before, so it was all new. But I seemed to be, people were very helpful, and I was getting along and doing fine. But the next thing that tipped me off that something might be wrong was that my boss came to me and said to me, "Do all the Canadian ladies use the F word as much as you do?" And I really was taken aback because I didn't realize I was swearing. And I guess I was. And very uncharacteristic again for me. And if you look at the literature, that's, one of the frontal lobe problems and indicators.
Getting an early diagnosis of dementia is really important for lots of reasons. Firstly, it allows the person with dementia, whilst they still have a reasonable amount of function, to actually make their own decisions about what they want to happen in the future. And I think people historically have thought, perhaps you wouldn't want to know if your memory is going to get worse, but actually what patients say is they do want to know, and they want to have the choices about where they live, the choices about who looks after them, the choices about in what way they'd be looked after. And so getting an early diagnosis enables people to make those choices themselves, rather than family healthcare professionals guessing what they would have wanted. It also really helps in preventing crises, and often we see patients or relatives really coming to us with a situation that's reached crisis point, and then intervention is much more difficult. And really, if we can prevent those crises, for example a relative that's wandering the streets and not safe, that's clearly beneficial. Another reason that it's really important to diagnose people early is that you can start to intervene so that you can maintain their function and maintain their quality of life. For example, rather than intervening at a point when somebody is really disengaged already from society, from communications with friends and family, you can actually encourage things and encourage them to do things that actually keep their mind more active and keep them more involved in what's going on around them. Whilst at present there aren't treatments that can cure dementia, there are some treatments, some medications that are available that slow the progression of dementia. And for patients and their carers, these are really important. And if we diagnose people early, they can actually get these medications whilst they've still got good function and actually slow the deterioration of their memory loss. There's really two stages in the diagnosis of dementia. The first is for the person who thinks that they may have memory problems to see the GP, and for the GP to exclude other conditions which overlap with dementia in terms of the symptoms that they present with. And this would include things like infections, brain tumours, thyroid disease, delirium. So it's really important that the GP doesn't jump to a diagnosis of dementia but actually excludes other causes of the same symptoms. If those causes have been excluded, the person can then be referred to a memory clinic, and it's at that stage in the memory clinic that the particular type of dementia that the person has got can be diagnosed.
Why did it take 2 years of problems? He was diagnosed as having endogenous depression, for which he took appropriate pills. And yes, he was depressed, but with 2020 hindsight, why didn't they look behind what was depressing him, where they would have found classic signs of dementia, the forgetfulness, the confusion, particularly losing spatial awareness? Because it turned out the most significant thing that he couldn't do was to read. It was reading the music that was the problem. It was tracking from line to line. But to go back to why did it take 2 years, I think for someone aged 50, dementia was not on their agenda. So a whole lot of other things had to be ruled out. And eventually, when he went to Cambridge and got lost driving in familiar surroundings, then that really rang alarm bells, and I took him straight off to the doctor.
I think one of the main difficulties that I and the rest of the family have with my husband's disease is people's total inability to understand it. When you mention the word dementia, which it's not always appropriate to mention, but when you mention a degenerative brain disease that's progressive, that sort of thing, and you hint that it's akin to Alzheimer's, people think of Alzheimer's disease, they think of somebody not remembering what your name is, not knowing what day of the week it is, not knowing who the Prime Minister is. Now, with a frontotemporal dementia, those kinds of things stay intact while an awful lot else is falling apart at the seams. So you get a situation where, because my husband is very articulate, because he can still read the paper and he's got time, he probably knows more about world affairs than most other people who've got busy lives. And he will discuss this with people and they will look at me as if, actually, it's me that's got the problem. What on earth am I talking about? Our medical friends are some of the worst. My husband cannot drive. He cannot now practice medicine. They know what the diagnosis is. They've only got to go to the internet, actually, and bother to look up how it affects people. They come to us, they say, "Oh, are you back driving again yet?" Now, this is a degenerative disease. It isn't going to get better. It's actually getting worse. We've had remarks like, "Oh, are you doing any locums, Bob, to pass the time?" And because they spend a short enough time with us that they don't see a problem, it's deeply isolating. And the children actually will Daddy to blow a gasket simply in order that people will see that it's real. What we are living with is very real.
It's really important in primary care for us to take very seriously when people or their carers are raising with us concerns that they may have problems with their memory. And when it's raised, it may be the only opportunity that we've got to take things seriously and look into things further. We're ideally placed in primary care to build up a relationship with our patients over time and to get to know them and to get to recognise changes in them. And we really should be being proactive to look at the patients that we're looking after and be looking out for signs of memory loss, personality changes, and being proactive in looking into what might be causing them. We should also be keeping our eye on people that we know are in the high risk groups, people that we know are at risk of developing dementia, and really looking at those and taking the opportunity to assess them when they see us. Even having done all of these things, there will be some groups of people with dementia who are really hard to reach. Perhaps those who are physically fit and don't normally come to their doctor's surgery, wouldn't have any reason to attend. Perhaps those who are being really well cared for by their family and so their functional losses aren't quite so apparent to the rest of society and people around them who might report it. And I think this group's really tough, and we have to think really carefully about ways to try and improve diagnosis and really direct resources to helping these people.
I felt a tremendous feeling of anger towards him, that I knew something was happening to him, and sometimes I would say to him, you know something's happening to you, don't you? And he didn't say yes, but he didn't say no. And I tried to play it down, although I had this awful gut feeling that it was tremendously serious. But I tried to play it down by saying, perhaps it's something like a chemical imbalance in your system. And if you have blood tests and get sorted out by the doctor, then it maybe can be put right with a course of tablets or something. Which, of course, if it had been something like B12 deficiency, which can be a cause of dementia, then it could have been put right by the injections. I mean, he has them now anyway, on a regular basis. Impotent fury, I think, would aptly describe the way I felt. I felt quite depressed because I felt so helpless, and I tried to get the help of the doctor, and the doctor did say he would come out and see him. But I thought probably he would refuse to talk to him anyway, even if he came out. So, impotence and anger, those were the two main feelings I can remember. Here was he going along with his life as he wanted it, and I was knowing something was going drastically wrong, and yet unable to get him to do anything about it.
Well, I think we'd just gone through a phase, just after we moved, when I realised we had a very urgent sort of something going on. And I did suggest nicely several times, would you go and see the doctor? Or I think we need to go and see the doctor. Or I tried to persuade him that, you know, his memory was really poor and that perhaps we could get some help. I remember really losing my cool one night and just saying, I just cannot go on living like this. It's just too awful. And it was just after Christmas, I think, I made an appointment to see his GP. And I put him in the picture, I gave him some examples of what had been going on and, you know, how the changes had sort of become more obvious after the move and everything. And he said, well, we don't have to think gloomy thoughts. He said, there's other reasons why people become forgetful. We'll do a full MOT. So I did get to the doctors with a view. I mean, I was upfront about the memory. I said, I'm worried about your memory, but the doctor said he hasn't seen you for ages and he'd like to give you a full medical. And he said, oh, well, I'm perfectly fit. I walk 15 miles twice a week and all the rest of it. And I said, well, perhaps we'll just get you checked out just to be on the safe side, because I knew he had high cholesterol. And I said, you need perhaps to go and have your cholesterol checked, if nothing else. So he did agree to go to the doctor, and he let me go in with him on the first occasion. And the doctor took lots of bloods, and we made another appointment, and all the blood tests had come back pretty well okay. So he talked to John, and John did agree eventually that he would go and see somebody about his memory.
There is so much more to be done, and it all starts with getting the right diagnosis. Thank you very much for watching, and the best of luck.